All right, everybody. It is 2:00 Eastern time, so we're going to go ahead and get the show on the road. Welcome, everyone, to the call. I'm really excited about it. Grateful that everyone took time out of your busy schedules to join us today. Real quick, for those that don't know me, my name is Philip Lamar, and I am one of the marketing sales directors here with Acmg. And for those that don't know Acmg, whether you've partnered with us for years, months, or maybe this is your first time joining one of our calls, Acmg stands for American Central Marketing Group, and we are proud to be one of the biggest FMOs in the country. We have the pleasure and honor of working with thousands and thousands of agents across all 50 states. And folks, our whole goal, our whole mission as an FMO is to serve you, is to help you. And we specialize in doing that by providing you with the top carriers, the best products, the best technology in the business, and of course, the highest commission schedules available. So that's what we do all day, every day. And today's call is going to be doing exactly that. I think you're going to get a lot of value out of this call. But before we get into the call, I want to also introduce a couple other people we have on the call today. My good friend, the founder and CEO of Acmg, Rob Swander, is with us on the call today. Also, we have Tara with United on the call, our good friend and business partner over at United. I'll introduce her and United here in a second. But before we do that, I want to mention a couple things. If you've been in the insurance business for any time now, whether this is your first day of being licensed or you've been licensed for 20 years, the fact that's going on right now in our country is the gig economy, or the self-employed workforce, is booming more than ever. Every single day, our team at Acmg is talking with people that are becoming self-employed, whether they're becoming an electrician, a plumber, a real estate agent, a contractor, a salesperson, whatever it may be. Every single day, people are leaving their comfy 9-to-5 job, their corporate job, to live their dream, to make as much money as possible, and to be self-employed. But one of the biggest roadblocks that we hear and that we see is health insurance. What do you do for health insurance? What do you do when you leave your nice job? They provide benefits for you. What do you do when you leave that, right? It's a problem. It's something that we hear all the time. And I guarantee you have people all over your market, all around your town, all in your city that have this exact problem. How can I find good health insurance, quality insurance that also doesn't break my bank so I don't go bankrupt my first year of business, right? That is something that's happening all over. What if I told you that our partners at Acmg have the exact solution for this roadblock? What if we told you that there are products, that there are carriers out there that have excellent, robust health insurance, dental, vision, ancillary products that your clients can enroll today, right now, if you wanted to? You don't have to wait till open enrollment. You have robust products that are excellent, that take care of your clients, but also put a lot of money in your pocket. Well, that is true. I am not lying to you. That is a fact. And today's call is going to be showing you exactly how you can help small businesses, self-employed folks, or heck, maybe somebody you know that just doesn't like their benefits they have with their company now. That is something that's happening right now. So I'd like to introduce everyone to, like I said earlier, our good friend, our business partner over at United. She is a top executive director with partners like Acmg, Tara. So I'm going to go ahead and hand it over to her. So Tara, without further ado, go ahead and take it away.
Awesome. Thanks. That is hard to follow. What an introduction. And I couldn't agree more with so many of the things that you have said. You're right. The gig economy is blowing up right now, and there is a ton of opportunity out there for you guys. So, Phil, I'm wondering if you need to give me, I just need to share my screen here, I think. So
yes, we can do that. Rob, can we give Tara access to share her screen real quick?
Good to go, guys.
Okay.
All right, Tara,
so
we can see your screen
put
right now.
this in my presentation mode here, and then we'll be good to go. All right. Are you seeing my screen right now?
We sure do. It looks great.
All right. Do you just see one slide, or do you see multiple slides?
We see one slide. It says United Health One, welcome Acmg, Triterm Medical.
Wonderful. So, as Phil said, right now is a huge opportunity in the individual space. And, our motto that we've kind of come up with as a United Health One sales team is finding ways to work smarter and not harder. So, one of the things that we want to target today with you guys, and we're, Phil said it, we've got a ton of different products that are available to you, but what we want to focus on today is our Triterm Medical Plan, which is our 3-year medical product, and just kind of talk about that opportunity. What's in it for the broker, what's in it for the client, how this product can work for you, and kind of just use this as our focal point for today. So, what is Triterm Medical? Very simple in the name. It's a 3-year medical plan. So if any of you have been or were in the pre-ACA space prior to any of the ACA plans being implemented starting January 14, this is written on that same type of medical chassis as those pre-ACA or those non-grandfathered and grandfathered policies. Okay, so we'll talk about this in a little bit here, but the underwriting you're going to find is going to be a lot like the olden days per se. So with the 3-year plan, you apply once for these 3 terms of coverage. You are getting a $2 million lifetime max over the life of the policy. The really cool thing about this is if you're accepted on this policy and we issue the plan for you, pre-existing conditions are covered after 12 months on the plan. So if we remember back to the pre-ACA days with those underwritten products, which this is an underwritten plan, your preventive care is included. You've got coverage for those doctor office visits. You've got coverage for prescriptions. So it's the same look and feel that people may have been familiar with prior to the implementation of ACA. We do have this in many states. This is our footprint with this product. So 19 states that this is in right now. Probably one of the most affordable non-ACA products out there right now. As I mentioned, it is written on that pre-ACA medical chassis. Pre-existing conditions are covered after 12 months with that prescription coverage being available, preventive benefits being available. There's a national network with this. You're dealing with the ACA plans right now where those plans aren't portable. They don't have nationwide coverage. We do utilize our own United Healthcare network, which does give them that nationwide coverage. And when you look at our Triterm Medical Plan, you are typically seeing a price point that is going to fall between our traditional short-term plan that we offer, which we aren't going to talk about today, but then also between where an ACA premium would fall. So you're going to find with this product that you're going to have a niche market with it. Is it for everybody? Most likely not. I'll be very candid with you on that, but you're going to find a really good niche market for it. And Philip said it earlier with the gig economy and the self-employed market that's out there right now. This is a really, really good fit in a lot of those situations. So as I mentioned, it's 36 months of coverage. It is one application. So it is 3 terms. Your first term runs 364 days. When that one ends, your second one picks up immediately, and then so on into that third term. But it is one application process that will cover that entire duration. As I mentioned, pre-existing conditions are covered after the policy has been active for 12 months. So in that first term of 364 days, your pre-ex, as mentioned, is not covered. But once you hit that second term and that third term, you are going to see benefits for your pre-existing conditions. Any conditions that may be diagnosed or arise after the original effective date of the policy, of course, are not going to be pre-existing conditions, and they would be covered for all 3 terms that the plan is in force. I'd be remiss if I didn't tell you this is not an ACA plan. This is not minimum essential coverage that the ACA defines. As I mentioned, it is written with that pre-ACA medical chassis in mind where there is going to be full medical underwriting with this product. Here are our benefits with this plan. Now, there are a couple of other plans within Triterm. I didn't include them in here simply because this information you're looking at right here is available to any of you that are appointed through Acmg with us. And this is directly from the product brochure. And the copay select max that you see here is going to be our number one selling product, simply because it is our best price point and it has a lot of copays for a lot of different things. So about 67 to 68% of our business currently overall in all of our states is written on that copay select max. Okay. But again, if you've got somebody that's just looking for simplicity, maybe they want just a high deductible, 80% coinsurance, 100% coinsurance, there's a lot of flexibility with this plan with deductible ranges and plan choices. But pretty traditional if you think back to the underwritten days where most plans, you meet your deductible and coinsurance plan is going to pay benefits based off of that. You are going to have coverage for your doctor office visits, urgent care, preventive care, ER visits, if there should be an inpatient stay, if there's a prescription that's needed. Again, you're going to see that a lot of that same feel of that pre-ACA plan with the design of the plan and how it's underwritten and how it's covered and different things that might not be covered. Okay. As I mentioned, this is a fully underwritten plan. So there are different things that come into play with this plan where a client is going to have to qualify. Height and weight is a factor on this plan. Okay. Um, if you are dealing with a family, this height and weight chart, now I'm only showing you the optimal range. You do have resources available to you within your broker portal that is actually going to show you the optimal range, the standard 1 range, and the standard 2 range. So there are different ranges that they can fall in that will, of course, affect the premium. If you're dealing with a family that has children on the plan that are 18 or under, you're not choosing a height and weight or a health class for them. They're all going to be rated optimal. Okay. Um, one thing to keep in mind, as we mentioned here, you may have somebody that their height and weight is perfect, but rate ups can still happen if they have a medical condition and they are taking a medication for it. Okay. If somebody doesn't fall within that optimal range, as I mentioned, there's standard 1 and standard 2, which is actually going to be available to you in your broker guide that's on the broker portal for you. Just as a side note, when you look at that height and weight chart, it's important when you're having your initial conversation with clients, find out their height and weight. That is part of the premium that you as the agent are able to control right up front during that conversation with your client. If they fall outside of the optimal weight range, standard 1 is going to give that individual a 10% rate up on their premium when you choose standard 1. If they are standard 2, that particular person is going to have a 30% rate up based off of their height and weight. Again, that is something you as the broker have the control over when it comes to giving them premiums up front prior to any of that underwriting being done. The other thing that you have the control over as well when giving them some initial rates is, are they a tobacco user or not? When we talk about tobacco, we talk about any forms. Doesn't matter if they're vaping, if they're chewing gum, if they're taking Chantix, that's tobacco use. Okay. And we look at that within the last 12 months. So that is the other thing that you as the broker have the control over when setting up this quote for them and giving them some initial rates. Tobacco and height and weight are two things you can control right up front. Okay. Underwriting decisions are made individually. So you might have a family where three of the people in the family don't have any medical conditions or prescriptions, but one does. Okay. Or maybe one of the individuals falls outside of optimal. We're only going to rate up their portion of the premium based off of where their height and weight falls. Okay. Could also see a situation where we might decline one person, but we still would underwrite the rest of the family, and the rest of the family could still qualify, and we could issue coverage for them. Okay. When looking at Triterm Medical, there's a few things to keep in mind with this particular plan. All except one state that we write in, you have to be 19 years of age or older in the primary insured, with the exception of Missouri. If you are writing coverage in the state of Missouri, you have to be 20. And in the state of Missouri, it is a little bit different that everybody, so you might have a family of, maybe you've got a husband and wife, that all have to have their own policy. So you've got to be at least 20. You all have to have your own policy. That is the only weird state, and that is Missouri. And then as far as max age, you cannot be older than the age of 63 years in order to purchase this plan. Dependents need to be under the age of 26 at the time of application. But let's say they turn 27 or 28 during the term of coverage, that is fine. They will remain on the plan until the duration of the 3 years ends. Should the primary insured end up passing away during the 3-year term of coverage, if there is a spouse on the plan, they may become the primary insured. This next point is extremely important to remember. If you are quoting a husband and wife and one of them is within that 2-year time frame of becoming Medicare eligible, always, always, always quote the youngest of them as the primary insured, because if you don't, and the primary insured would reach the age of 65, we are going to terminate the policy for everybody that's on it. So again, if you have somebody close to being 65 and there is a younger spouse, list the younger of them as the primary insured. Another thing when it comes to eligibility is if they do purchase the Triterm plan, let's say they purchase it in Texas and they are moving to Florida, we are going to terminate that plan. However, they are able to apply for a new plan in Florida in this example, because we do offer Triterm in both states. So if they move to a different state, the policy is going to terminate. Okay, so those are just kind of some housekeeping items to keep in mind when it comes to writing the Triterm plan. What's great about, as I mentioned, the Triterm plan, unlike the ACA plans are out there, this is a true nationwide network. This is the largest network in the nation with almost 1.5 million providers to choose from, over 6,500 hospitals. And the last time we had looked, and I'll have to look and see if we maybe have some updated numbers from 21, but in 2020, the average discount across, and again, this is as a whole with all covered services, was about a 56% network discount. So it's really important that your clients are utilizing network providers. Another thing to note with the network, and we talk about the network so passionately because it's our secret sauce. We own the network. We can pass on these really deep discounts to our insureds, which are very beneficial when they're utilizing their benefits. But if you were to look at every hospital from East Coast to West Coast, north to south, United Healthcare has 85% of those hospitals in our network. It is a significant pool of doctors and providers that your clients have access to. As I mentioned, the Triterm plan it's really flexible. You've got a lot of plans with many different deductible choices to get your client within a budget that is going to be comfortable for them and feasible for their whatever their situation is. You're not paying for unnecessary benefits. Those minimum essential plans, the essential health benefits that are mandated by ACA plans, those aren't built into these plans, so you're not buying unnecessary benefits. As I mentioned, it is fully underwritten, but it's simplified underwriting. So the series of questions that are on there are yes or no. You've got to be able to answer no in order to qualify. And then there's a couple of free form questions where if a client is taking medications for something that is not an auto decline, we want those details, because then that is where the underwriter is going to do their part to underwrite that risk as a whole to see what we can do as far as offering coverage to them. Okay. As Philip mentioned earlier, these plans that United Health One are selling, whether it's our Triterm plan or any of our other products, you can apply anytime. There are no open enrollment periods. You don't need a special election or a qualifying event in order to buy these plans. You can apply any time of the year. The one thing with Triterm is the soonest effective date that you are able to apply for on these plans is 5 days out from the date we receive the application. So that is something to keep in mind when your client is applying. If they know that they might need a specific effective date, keep that 5-day rule in mind with that effective date. And then affordability, that the network that we offer on our plans, and utilizing our own network, and we're not renting out or utilizing somebody else's network, allows us to be competitively priced on these particular tri-term plans. So as I mentioned previously, it is 3 terms of coverage, but you get 1 ID card for the entire 3 years of coverage. Okay. Um, should something come up where a client would obtain other coverage elsewhere and they no longer need the tri-term plan, they can certainly cancel that plan at any time. Should there be any unused premium at the time that they're making the cancellation request, we do refund that unused premium to your client. Now, one of the things I will keep it that you'll want to keep in mind with your clients is, should they cancel prior to the 3-year duration being over, which is fine, they're not required to keep it for 3 years, but should they cancel within that 3-year time frame, they do have to wait 6 months to reapply again on that tri-term policy with us. Okay, so again, they can cancel anytime, but if it's before the 3 years is over, they do have to wait 6 months to reapply on the tri-term product. Um, with our tri-term plan, it is tied to an association. It is $10 a month. So when an online app is done, the $10 is automatically included. But I like to list out a lot of these things that are included in this. So people will ask, or agents will ask, does my client have to have this? Yes, they do. It is a lot like going into a Costco or a Sam's Club. You have to have a membership in order to go in their store and buy what they have. This is the same concept. You have to have the FACT membership in order to come into United Health One and buy our Triterm Medical plan. But there's a lot that comes along with this. I think one of the biggest things that every insured on the policy gets is a $20,000 accidental death benefit, dental discounts, vision discounts, shopping, travel discounts, pet insurance, scholarships. There's an array of different benefits that come along with that $10 benefit. So I like to line this out for people so they understand, yes, the membership is required, but there's a lot of benefits that are built into it. A lot of different benefits that people have the ability to utilize. Payment options, we offer monthly only. Okay, so they're not able to pay for a year in full at a time. It's always monthly. However, we will do credit card or bank draft, and we do accept all major credit cards: American Express, MasterCard, Visa, Discover. Okay, again, monthly only. They're in most states. There are a few states that have a couple of variations on the application fee, and then if it's refundable or not. But by and large, most states have a one-time $40 application fee, and that is a non-refundable application fee. So, and again, when you're doing the online application, that $10 fact fee and this one-time application fee will automatically be included into the premium that is seen in the online application. So outside of the product itself, we like to kind of talk about a little bit on why do we want you to sell Triterm Medical? Why? So there's really kind of 2 different portions to the why. Why do we want the broker to sell Triterm Medical? Really for 3 reasons. It's going to provide value. The lifetime value calculations when it comes to, as Philip mentioned, the compensation and the ability to make money in this market, and then and working smarter, not harder. So providing value. Every single bullet point that is here, this is a statement from a broker that I personally work with. I reached out to brokers and I wanted to find out, why do you sell this? What is the value in it? And there's a variety of things, to the benefits, to the network, to I know it works. So I like to share these because this isn't just me saying there's value in Triterm. This is brokers saying I sell Triterm because this is what I see as the value in Triterm. So I'm just going to leave this here for just a quick second so you can kind of read the perspective of some of the brokers that I work with that maybe just started selling it or have been selling it since we implemented this a few years ago. I mentioned one of the other things is the lifetime value calculations. We do sell traditional short-term medical plans, um, but you don't need to be a rocket scientist to know that selling a Triterm Medical plan, as you can see here, and I'm not going to sit and talk to all these numbers, but one of the couple of things that I am going to point out here is when we talk about the average persistency of a traditional short-term plan versus a Triterm Medical plan, and then of course the average premium, you look at writing 10 members on a short-term, 10 members on a Triterm Medical plan, and you look at the lifetime value of Triterm, it's significantly outweighs what it is on short-term medical. 158% increase by doing that. Now, yes, it is a niche market. It might not be the best fit for everybody, but I've got a ton of brokers out there that are selling this that will start with Triterm Medical really as their go-to when they start working with a client. And then the last thing I mentioned was working smarter, not harder. As I said, the average persistency, almost 2 years. You're not having to spend a lot of time with existing clients. You have time to write new clients. And you guys all know what it's like in the market right now. Time is money. Additional time spent with new prospects is going to give you a larger book of business. A larger book of business results in higher revenue. And then you have the ability to start selling different products and adding on different products to those clients. So working smarter, not harder. But the flip side of that is, why Triterm Medical for the consumer? Well, we want the broker to benefit from it, but we also, of course, want the consumer to benefit from it. So you're future-proofing the customer as much as you possibly can, because you are removing that risk of the possibility of them becoming uninsured during the middle of the year. You're offering your client one of the best non-ACA plans out there, and you're giving them the best level of benefits for that longest period of time. Future-proof your clients. When we compare side by side, our Triterm versus our short-term plan, there's some significant differences. Again, is it for everybody? No, it's not. But I'm going to tell you, if you get somebody on this, they will keep it. Okay. As I mentioned, that Copay Select Max is one of our it is our best selling plan. You're getting the 3 years of coverage, the pre-X covered after 12 months. The preventive benefits are different. Doctor office visits are different. Prescriptions, air ambulance. And then, as I mentioned, should they cancel early, we do prorate and refund unused premium. Okay. Short-term medical plans, we do not. So, as I mentioned, it is a niche market. Okay. Philip mentioned it, that gig economy is exploding. This is where I would start with that. If any of you are working with any self-employed people, or simply those people that just don't want the group benefits, or they want to have something on their own, they want to have a little bit more control over their benefits. This is going to be where we're going to see a lot of that business come from, especially that 400% of federal poverty level. That lifetime value. We look at the endless ability for you guys to make more money with this particular product versus other products that are out there. That working smarter and not harder. Save time. Allow yourself to be able to grow your book of business, to work with new clients, to continue to add to your book of business by writing a plan where they can stay on it longer, free up your time to write other products. And I think most importantly is you're future proofing your clients. Okay. You're giving them that best non-ACA plan for the best dollar for, that nationwide network, which they don't have on a lot of plans that are out there, and getting rid of that risk of potentially being uninsured in the middle of the year. So to tie right into that, for any of you that are on this call, that maybe you've been appointed with us for a really long time and you've never written a Triterm medical plan, or you did not write a Triterm medical plan at all in 2021 or in the first and within the first couple months of 2022. This is one of our contests that is going on right now. It does run through the end of the year, okay? Um, but you do have the ability for writing 5 applications, making $500 an app on this particular product, okay? And again, you did not write a tri-term plan in 2021 or within the first 2, and I shouldn't say or, not in 2021 and not in the first 2 months of 2022. So a 14-month time frame, this contest is eligible for you. You do have to register for this, and I'm certain we got that information into the hands of Rob. So you might want to reach out if this is not something you have registered for yet. The other contest that we have going on right now as well pertains to tri-term and short term. But as you can see, this is a significant bonus. Now, this is running for another month and a half. You also will see here with our tri-term medical plans, this is a $250 bonus for those tri-term plans. This contest, you do not have to register for. Spring into action, you do not have to register for if you are part of ACMG. Welcome to Triterm, you do have to register, so that just keep in mind that distinction, okay? A lot of really, really good opportunities out there for you guys. We're going to do more of these in the future where we're going to focus on the other core products we have, like our short term and our fixed indemnity. And then we've got an an entire portfolio of ancillary products that you're able to bundle in as well to only increase, that compensation ability with you guys. So with that, I do want to give you my counterpart, David Maxwell, is not on here today. He is on business travel. But David and I have a great partnership with ACMG. We're here to help you guys, here to help you grow your business. Product questions you have, underwriting questions you have. We want to be able to, and we've had conversations with Rob about this. We want to remove obstacles for you guys so you can do what it is that you do best, and that is get out there, satisfy your clients, sell the business, and make money. So if we can help you guys down the road, if there's questions you have, please don't hesitate to reach out to us, and certainly don't hesitate to reach out directly to ACMG as well. So with that, Philip or Rob, I'm going to turn it back over to you guys and see if there were any questions that came up in the chat.
Awesome, Tara. Great presentation. Thank you so much for going over all of that. I'm sure every single person here sees tons of value in what you and United has to offer them and their clients. So great presentation. We do have quite a few questions, Tara. So
okay.
Here's what I was thinking. I'll read them to you if that's okay. I'll read them
Mhm.
off to you, and then you just answer however you feel is best. Okay.
Okay.
So I'm pulling this up here. So let's start with, let's see here, JD. So JD asked at the very first, I already answered this. We did record this, folks. So everyone, we always post recordings for our meetings at ACMG on our YouTube channel. So if you want to watch this recording, that way you don't have to, take a bunch of notes and review that. You can watch our recording on our YouTube channel. Okay. So you can just go to ACMG on YouTube. You'll find our YouTube channel, and we will post this. So this is recorded. Yes. Brad asked a question. What is the look back period for pre-existing conditions for the tri-term?
It is 12 months.
12 months. So
Yep.
Brad, that's
Yep. And I actually, I want to show you, are you still seeing my screen?
let me pull back up the questions. Yep, we can see it right now.
Okay. So let me, every broker that is appointed with us, you guys have the ability to look into the broker portal, and you have the ability to actually pull up the brochures for every single state. So I'm just going to pull up a tri-term brochure so you can actually see. I'm telling you, the broker portal is a wealth of information for you guys, right down to the product information to pretty much anything that you're going to need out here. So when we look at the 24 months prior to the effective date, this is why I wanted to peek at it. So we're going to look back 24 months to determine, is something a pre-existing condition? Then it is not covered for the first 12 months that the policy is active.
Perfect.
Okay.
I think that answers that perfectly.
Okay.
So Brad, that's answered your question. Randy asked, I thought you said this is in all 50 states. I'm in Washington, and that is not on your map for Triterm. So Randy, at the beginning of the call, I mentioned we work with brokers in all 50 states. Tara can give you more clarification as far as the Triterm goes. I know United has other products. So yeah, Tara, what are your thoughts?
And again, as I mentioned, the website is a great tool for you. So when you log in, you're going to see a map here. Now, I know this is going to be a little bit small to see right now. This is going to show you by state what product is available in that state. Okay. As you can see right here in this section, this is our, the orange section is our Triterm section. Okay. So if you are selling multi-state, you do want to reference this chart because it is going to tell you, oh, I'm in Alabama. Okay, here are the products that are available in Alabama. Oh, I'm in Washington. Okay, here are the products that we have available in the state of Washington. Okay, so yeah, we definitely don't sell Triterm in Washington. I wish we sold it in more states, but unfortunately at this point we do not.
Yes, and hopefully, like Tara said, that will become a thing. Some states, that we're working with that on that. So thank you, Tara. You answered that perfectly. Let's keep the ball moving here. We have quite a few great questions here. Is the 3-year approved in those listed states? I'm assuming that's the Triterm for the states you listed. Do you understand that question, Tara? Is the Triterm approved in those states listed? I would assume yes.
Yes. Yep. So I showed a map at the beginning. The states that were blue are the states that it is in. However, keeping in mind, you can always come back to this product grid and you can see the second section in orange right here says Triterm Medical, and it's going to show you what states that it is in.
Perfect. Very good. Jeffrey has a question. Obviously, this is just a guess. When will Triterm be available in Michigan?
It will not be available in Michigan.
Okay.
Very simple. Michigan has some really weird rules, even as it comes to just traditional short-term medical plans. As I am aware of right now, it is not being filed or waiting for approval in any additional states outside of the states that we are currently in today.
So Jeff, that is the answer to your question there. Brad, let's see there. Okay, this is a great question. Mary asked, are these plans eligible for ICRA reimbursements? So ICRA, I would even say maybe HRA
I'm not
reimbursements.
100%. No, they are not. And one of the things that I'm going to show you again when we come to the Triterm Medical plans, under eligibility, we don't allow an employer or anybody outside of the individual to pay for these plans. Okay, so that is something we need to keep in mind. I will have to find it for you, but no, they are not ICRA eligible.
Perfect. Very good. Thank you so much. Great. Okay, so Matt asked something here, and I'm sure a lot of people are thinking this. So real quick, I'm going to put a pause on questions. For anyone that has any questions for contracting or commissions, if you actually open up the chat, I'll throw it in there. I posted it just maybe 2 minutes ago. But if you open up the chat, I just threw it in there. We're going to make it super easy and super efficient for all contracting, all questions, and then all commissions questions. All you have to do is email us at agentservices@acmgsales.com. Again, that's agentservices@acmgsales.com. You can open up the chat and you'll see that in there. We do offer all contracts, everything from if you're a MGA, a GA, if you're a senior agent, whether you have 1 or 2 agents on your team, or if you have 100 agents on your team, doesn't matter. We do have a contract exactly for you. There are a couple things, obviously. What is your production? What does that look like? How many agents are in your team? Like I said, we have the highest commissions available for where you're at in your business. So just email us. We make contracting very simple. We make it very easy, and we'll email you all over all those schedules. So just want to answer that question. Matt asked that, and for anyone else that's asking those. Ann asks, let's see here. Can you send appointment paperwork, Ann? Just email us at agentservices@acmgsales.com. This is a great question, and my partner Rob can probably answer this better than I can. Is there an appointment fee? Is there an appointment fee to get contracted? Rob, I can't remember what our deal is for that as far as what that looks like. Do you have any insight?
Hey guys, there are appointment fees for each state, but if you're contracted with ACMG covers the first year.
Thank you, Rob. That's what I thought it was. Just wanted to confirm. So Ann, that's a big deal. If you get contracted with ACMG, most states have an appointment fee. It depends. It can be a couple bucks. It can be $40. It can be $30. Every state has a different appointment fee. But like Rob said, ACMG will cover your first year appointment fees for all those states. Okay. So we'll take care of that first year. Is there a list of states in which we can write Triterm? And Tara has posted that map. You can
and
you
again,
can
it is available. If you are appointed with us through ACMG, you have access to a broker portal, and I could send this over to you guys too if you want to distribute it as well. So, but yes, it is out here. This will tell you by product what state is that product in. So as you can see, Triterm is in Alabama, Arkansas, Arizona, Florida, Georgia, Iowa, Indiana, Kentucky, Louisiana, Missouri, Mississippi, North Carolina, Nebraska, Oklahoma, South Carolina, Tennessee, Texas, and West Virginia.
Perfect. Wonderful. So I'm keep going through here. Okay. Looks like, give me a second. I'm skimming through some questions here. Okay. Matt asked a question here. Will Triterm stay the same if HHS lowers the term of short-term medical plans down to 3 months, as is expected this August?
At this point, because we have not been given any information in regards to that, it's going to remain business as usual for us. Triterm is still considered a short-term medical plan. So at this point, we are not made aware of anything happening to it. So we're going to continue business as usual right now.
Continue business as usual, Matt. Let's go through here. Burton asked a good question. How do you register for the incentive bonus? Tara, I know you've already mentioned this a couple of times, but do you mind just recapping that really briefly?
Nope. So the welcome to Triterm is the only one you have to register for. Okay. And I will, Rob, if that flyer hasn't already been sent to you for welcome to Triterm, I will get it to you so you can distribute. And then there is an active link within the flyer that you can click on. You type in your national producer number and you say, yes, register me. But again, you do not have to register for Spring Into Action, only welcome to Triterm.
Perfect. Thank you, Tara, for clarifying that. It looks like someone asked, can we get the YouTube channel? Give me just a second. I'm going to go through a couple questions and I'll post our YouTube channel. That way you can look that up. So we'll send that link here in just a second. I'm going to read a couple other questions here. That looks good. Okay. Again, a couple of these are some repetitive questions. And so if you're curious what states United Healthcare you can do business in, or for the Triterm specifically, if you're already appointed, Tara mentioned it, the broker portal has a whole suite of resources for you. Everything from brochures, products.
And it's right here. Click the map. It opens up the grid for you.
Makes it super easy there. So Thomas, are you in Florida, Fort Myers area? Yeah. So think of it like this. I know Florida is a great state for insurance. There's a lot of carriers, a lot of things you can get there. So yes, Florida is a great state for Triterm, for short term.
It's actually one of our top states as a whole. So that's a really, really good market to be doing business in with United Health One and ACMG.
That is very true. Florida is a great market. A lot of people there. A lot of people need insurance, especially those that are in the gig economy. If everyone opens up the chat, I'm going to post a couple things here real quick. If you all view it, my partner Rob just went ahead and he posted the YouTube channel for ACMG. So if you want the recording, if you want to watch it, all you got to do is just click on that YouTube link that Rob just posted. Or if you want to watch it later, just click it, copy, and paste into a browser, and you can always view our page for not just CNI, but any of our carriers and our partners that we have. And then also for contracting and commissions, you just have to email us, agentservices@acmgsales.com. We make it super simple. Also, Rob just posted our Facebook group. We do have a Facebook group, actually one of the biggest insurance Facebook groups anywhere in America on Facebook. We have thousands and thousands and thousands of agents in our Facebook group. It's a resource page. You can ask questions, get marketing advice, ask advice about really anything insurance related. So we do have that Facebook group available for you. So I'm looking through all of these questions here. We hit all of them, Tara. So I don't see any other
Awesome.
questions. I wanted to see, do you have any final thoughts, any closing thoughts for everybody on the call today before we end?
No, I don't. And again, please, 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 if you are not contracted, reach back out to ACMG. They will make sure that you get taken care of. We've got a great partnership with them, looking to do a lot of exciting things. If we can be of help, my info is here. You know how to reach out to the ACMG family. Don't hesitate to do so. There is a ton in our portfolio that you guys have the opportunity to be able to sell to fit whatever need your client might have or whatever their situation is. So I appreciate everybody's time today. Thank you, Rob and Philip, for the opportunity to be able to get in front of your people and to share this information with them, and looking forward to lots of successes moving forward.
Wonderful. Well, we appreciate your time today, Tara. Again, everybody, if you want to watch the recording, you can open up the chat. My partner, Rob, he posted our YouTube link to watch this recording. He also posted the link to join our Facebook group, and it's just a big insurance forum where you can ask any insurance question. There's people here to help, a lot of experience. Also, for contracting, commissions, really simple. We offer MGA, GA contracts, producer contracts. We'll make contracting very simple for you. Just email us at agentservices@acmgsales.com. And again, like Tara said, this is, quite frankly, it's a no-brainer. You're going to want UHC out of all carriers when it comes to health insurance. When you look at brand awareness, when you look at a company that pays out claims, that takes care of clients, that has robust benefits, United Healthcare is the top dog. You're going to want them in your portfolio. So strongly encourage, if you're not contracted, reach out to us. We'll help you. And if you are contracted, and depending on your production, what your situation looks like, you want some higher commission schedules, reach out to us. We're more than happy to have that conversation. So again, everybody, thank you for taking time today to join our call. Tara, great presentation. Thank you so much for your time, everybody. We hope you have a successful week, and we will see you all next time. Take care, everybody.
Thanks. Bye-bye.